Hi everyone, I'm Dr. Victoria Gomez. I'm an assistant professor in the Division of Gastroenterology and Hepatology at the Mayo Clinic in Jacksonville, Florida. I also have a really big interest in obesity and metabolic diseases, and I've been working in conjunction with the bariatric clinic and helping many patients achieve their weight loss goals through newer procedures that we are now performing that are non-surgical. So I'm very excited to be able to talk to you about one of these procedures today. But a little bit of information on what you may or may not know about weight gain and the increased risk of risk factors with your health. So we now know that weight gain and obesity, which is defined as a body mass index or BMI of greater than or equal to 30, is associated with significant medical and psychosocial conditions. In fact, we know that there are over 200 medical conditions that are associated with weight gain and obesity. And since this is the National Colon Cancer Awareness Month in the month of March, that obesity is also a risk factor for developing cancers of the colon and rectum. So if we can learn how to, by being able to help my patients lose weight and follow their weight loss plans and goals, I do think that we're able to overall improve people's quality of life and overall well-being. So I want to talk to you today about a new medical procedure. It is non-surgical, meaning this is not an operation that we perform endoscopically by many GI doctors. It's called the endoscopic sleeve gastroplasty, or ESG. This is a procedure that we are now offering at a few of the Mayo Clinic sites and at a few other institutions across the United States for people who have tried to lose weight but have not been able to sustain or achieve the weight loss with just diet and lifestyle interventions alone. Now, not to be confused with the surgery, the sleeve gastrectomy. That is an operation performed by a skilled surgeon. The procedure that I'm referring to is, again, does not require going into the operating room, and it is done on an outpatient basis, meaning patients go home either the same day or the following day after a short overnight stay in the hospital. So I have an animation that I want to share with you. So the ESG is performed with an upper endoscopy, which is what we commonly perform to look at the esophagus, the stomach, and the intestine. Under anesthesia, we go down into the stomach and we use a suturing device that we attach to the endoscope that we're using, and we create a triangular pattern of sutures that are non-absorbable. And we go from the anterior wall of the stomach to the greater curvature and then the posterior wall of the stomach. And after we finish the suturing pattern, we tie it all together with what's called a cinch device. And we work our way from the distal part of the stomach all the way to several centimeters before reaching the esophagus. And what we're left with is gastric plication, or we're able to modify the shape and the volume of the stomach. This procedure takes under 2 hours, and our patients, once they wake up from the anesthesia, they then spend the night in the hospital just for an overnight observation to make sure that they do well. I'd like to share with you another image of what your stomach looks like before and after the ESG. So you can see here in this representation that the dotted line represents, your stomach before the procedure, and then you can see just how much smaller the volume of the stomach is after undergoing ESG. So similar to surgery, we're able to reduce the volume by well over 50%. And in doing so, this helps people feel a lot fuller more quickly with eating, so they're able to practice portion control. People can feel satisfied longer. And we also know through other studies that the ESG promotes reduced gastric emptying, meaning food contents will hang around for a longer period of time in the stomach. And we think that this just further enhances that sensation of satiety with eating. Here at the Mayo Clinic, we've helped many patients achieve weight loss with the ESG procedure. But what is very important to understand about this procedure is that this is not just a one and done or a cure, that this is just a small piece of the puzzle. So you will be working very carefully in a multidisciplinary fashion with not just myself in the clinic, but with our team in the bariatric clinic. So you'll be working with the weight loss physicians, the dietitians, the behavioral psychologists, and you'll be seeing all of us several times along the way before we even proceed with undergoing the ESG. And it's important to understand this because, unfortunately, weight issues and obesity, we now know so much more about it that it's not just a matter of eating less or exercising more, that this is a lifelong condition. But people can be very successful in controlling their weight, but it requires a lot of self-accountability. So only by seeing everyone periodically in the bariatric clinic and following a healthy lifestyle would the endoscopic sleeve gastroplasty really benefit you. A few other key points to be made in terms of weight loss. People can lose around 15 to 18% of their total body weight loss at the 12-month period after the ESG. How does this compare to diet and exercise and bariatric surgery, some may ask? Well, diet and exercise, we know, at most can help people lose maybe 5 to 7% of their total body weight loss. But we know that over time, while someone is trying to lose weight by reducing their calories, the body senses the starvation, so it sends these signals for you to want to eat more. So over the long term, diet and exercise are usually not permanently successful. And then on the other end of the intervention, so bariatric surgery will help people lose even more weight than diet and exercise alone, and they would lose more weight than people who undergo endoscopic sleeve gastroplasty. And so what is important about all of this, my take-home points are that to help you make the best decision with which weight loss intervention is best for you, it really needs to be done under the supervision of your physicians, your dietitians, your psychologists, etc. That there isn't just a one procedure fits all, that it has to be tailored to what your needs are, what maybe your risk factors are for surgery versus non-surgery, and many other factors that come into play. So I'm going to take a few minutes to answer some questions. So let's see here. Someone asks, so what happens to the stitched section of the stomach? So remember, the ESG, we're not cutting out part of the stomach. We just suture part of it to make the stomach smaller. So this stitched section of the stomach stays there. It doesn't cause food to get stuck. It doesn't reduce releasing acid or reducing absorption of products or liquids. It hangs out there, and most people are still able to, eventually progress their diet, take their same medications. Let's see. A very good question. Someone asked, does the ESG procedure help patients with polycystic ovarian disease? While we don't have any studies just looking at this particular condition with PCOS or polycystic ovarian syndrome, we do have data that shows that ESG and just weight loss in general help improve many medical conditions, including women with PCOS who may also have insulin resistance, diabetes or prediabetes, and infertility. So we know that by losing weight, that many women can become more, fertile again and go on to be able to conceive, and as well as improve those other metabolic conditions such as insulin resistance, high blood pressure, hirsutism, which is increased hair growth. Let's see. Important question here, is the ESG covered by insurance? Unfortunately, no, not at this point, and it is probably true for almost all centers in the United States. However, with all the data that is coming out showing the positive outcomes of weight loss with this procedure, we're hoping in that several years' time that we will be able to provide the data that we need for insurance companies to begin to cover it. So at the moment, it is all out of pocket. So another good question, what is the incidence of reflux after the endoscopic sleeve? Typically, we screen patients very carefully in the clinic. So if we had a patient who had severe reflux disease, then this procedure may not be the best option, because we know that by making the stomach smaller and more tubularized, that reflux can potentially worsen. However, weight loss in general improves a lot of people's gastroesophageal reflux. So it's not to say that we would automatically exclude someone that had reflux. We'd have to see how severe it is and to see if there has been any end organ damage, such as esophagitis, that could be caused by the reflux. What are the risk factors for endoscopic sleeve gastroplasty? Well, there was a retrospective study that was published by 3 large centers in the United States that looked at almost 250 patients that underwent ESG. And fortunately, there were no mortalities, but on average, I quote my patients that there could be a very small risk of issues such as bleeding either during the procedure or post-procedure. Usually the bleeding during the procedure is very treatable. There could always be a risk of placing a hole in the stomach that's called a perforation. But again, we can usually close those up during the procedure because we're suturing. But every now and then, people could be at risk of contents leaking outside of the stomach and forming an abscess, which is an infection. And so we try and reduce these risks by giving people antibiotics before the procedure and for a few days after. And then even more serious issues such as blood clots to the lungs, that's called a PE or a pulmonary embolus. And there have been some documented, but we think that the risk of PE is probably in people who have maybe had blood clots in the legs or were immobile in the procedure for many hours. The beauty about this procedure is that people are under anesthesia, usually on average for 2 hours or less. And when they recover in the hospital, they're out of bed, walking the hallways already. The recovery is remarkable, that in less than 24 hours, my patients are ready to go home, go back to work, start exercising immediately. But the most common signs or symptoms that people may experience after the ESG can include some nausea and some discomfort in the abdomen, but we have really good protocols in place to reduce nausea and vomiting after the procedure and for pain control. Age restrictions. Over the age of 18, in terms of upper limit age restriction, we don't have one per se. It has not been established. But because this procedure does require general anesthesia, we would take the same precautions and risk stratification that we would with any invasive procedure. So people who have active heart or lung conditions or who are very debilitated, those are just some of the conditions that we have to take into consideration and make sure that that person can undergo a procedure under anesthesia. So no set upper limit age restriction. It's case by case. Let's see. Someone asked about how often are the revisions done, and how do you know when a revision is needed, and how much is a revision? These are really great questions. So the data for how often revisions are being done after the endoscopic sleeve gastroplasty have not been readily published. But we know, discussing amongst our medical community, that in about 20% or less of people, their endoscopic sleeve could potentially come undone or become very loose. Now, reasons for this are several. There could be some technical factors if maybe the sutures were not placed full thickness, meaning from the inside of the stomach to the outside. And so, we work hard to reinforce our sutures and keep the same suturing pattern for all our sleeves. And then there are also potentially some lifestyle issues or factors. Not everyone is going to be 100% successful with a weight loss intervention. And so people who may start consuming larger amounts of food or eating faster or not following the plan that they were following initially could be at risk of stretching out that stomach and causing the wrap to come undone. Keep in mind that the stomach is a pretty thick muscle, and that no matter what procedure or intervention you undergo, that there's always a risk for it to stretch open. But fortunately, in people who we have identified and we've been able to, prove that the sleeve has come undone, that we would then put them through the same intense classes and counseling in our clinics. And then if we think that it is indicated, that you can go in and retouch or resuture the stomach. So that is a possibility. In terms of how much it would cost, that has yet to be determined. It would probably be based on the hospital or the institution's policies. Let's see. Can you undergo endoscopic sleeve if you have a bleeding disorder? We would probably need a little more information in terms of what kind of bleeding disorder, but keep in mind that the ESG involves placing sutures with a needle. So just like when we sew or when surgeons operate, that we're always going to be going through blood vessels, even tiny blood vessels. So if people have a really significant bleeding disorder, they could definitely be at risk of bleeding during and after the procedure. So we would need to screen patients very, very carefully. So along the lines of that question, a few people have asked, is there an exclusion if they have what's called a factor V Leiden mutation? I can't say yes or no. Again, this would require us to explore their conditions in more detail and talk to their doctors. But anyone who is at risk of spontaneously bleeding could be at risk of bleeding from this procedure. The same thing holds true if people have factor V Leiden mutation and are at risk of throwing blood clots, that we would need to work with their healthcare providers to see if they could come off of their blood thinner around the time of the procedure, because eventually they'd need to go back on it. But, so it's case by case. Let's see, what about if you are a transplant patient? Now, this is a fantastic question because, especially at the Mayo Clinic, we're a very large volume transplant center. And so as a gastroenterologist, I frequently collaborate with my colleagues in the various transplant divisions, so liver, lung, kidney, and heart. And so different organ transplant programs require a certain BMI cutoff. And the problem is that, someone who needs an organ transplant who is very affected by their disease but there really is not strong data to support guidelines on this yet, but the field is evolving. Let's see, can you get a tummy tuck during the procedure? So not during the procedure, so keep in mind that this procedure is endoscopic, meaning we're not going from the outside and invading the abdominal wall. However, if people lose a significant amount of weight, they can develop excess skin that can cause lots of problems. And so there could be a role for, talking to your doctors after you lose a lot of weight to see if you qualify for a tummy tuck, or to be able to remove excess skin by a plastic surgeon or a surgeon who performs these procedures. Let's see. Someone also asked, could the